So we talked about the osteology and the arthrokinematics and kinematics of the different joints of the elbow and forearm. And I talked a little bit about force transmission through the interosseous membrane. So most of the interosseous membrane fibers between the radius and the ulna are oriented 45 degrees from the long axis of the forearm, and that helps transmit compressive forces from the hand to the upper arm. So pushing up actions, like pushing up out of a chair or, actual push-ups, or getting up from the floor using your hands, create a compressive force passing through the hand to the wrist. 80% of which is transmitted through the radius at the radiocarpal joint, because the big end of the radius is distal, and so at the radiocarpal joint, the radius is getting most of the force. There's a little articular disc between the ulna and the carpals, which absorbs force a little bit, but the interosseous membrane takes up that proximally directed force, passes it up the radius, and transfers it to the ulna, which is bigger at the proximal end. So basically, it takes that force from the big end of the ulna to the big end of the radius. So as a result, the compressive forces enters the distal forearm at the radius and exits the proximal forearm through both the humeroulnar and the humeroradial joints, and then is transferred up to the shoulder. So that interosseous membrane allows that force transmission to go from the radius to the ulna, which is pretty cool, actually. The direction and the alignment of the interosseous membrane helps distribute the forces more evenly across the elbow, so you don't get unequal forces at the elbow. If the interosseous membrane wasn't oriented at 45 degrees, if it was oriented 90 degrees, a compressive force directed up through the radius would slacken the membrane rather than tensing it. And a slackened or loose membrane, like a loose rope, can't transmit a pull. So there's the little section in the book where they talk about clinical insights, and they talk about a pulled elbow, which is sometimes called nursemaid's elbow, where you actually, the radial head is traumatically pulled out of the annular ligament. A lot of times it's caused by a sharp pull, like a mom pulling on the kid's arm as you pull it into the sleeve, or holding on to a little kid by their arm as you go up the stairs, or the dog, walking the big dog. So children are more susceptible to this because their ligaments aren't as strong, for one thing, and they're smaller and they're getting pulled around a lot more than adults are. So it's just something to be aware of in terms of elbow injuries. So in terms of innervation, the musculocutaneous nerve supplies most of the elbow flexors except the brachioradialis and the Pronator teres. So the brachialis and the biceps brachii get the musculocutaneous nerve. The radial nerve gets all of the muscles that extend the elbow. And similar to the way the sciatic nerve innervates the back of the legs, the radial nerve sort of innervates the back of the arm, so the posterior side of the arm. So most things, if they're on the posterior side, like wrist extensors and elbow extensors and that sort of thing, they get the radial nerve. So that's pretty easy to remember, I think. The median nerve supplies all the pronators of the forearm. So a lot of the anterior lateral structures in the arm get the median nerve, and the pronators are sort of anterior lateral. So the innervation is pretty easy in the elbow and forearm and makes sense. So the prime movers of elbow flexion are the biceps brachii, the brachialis, and the brachioradialis. So the way I remember this is 3 B's to bend the elbow, if you want to think of it that way. The Pronator teres does have a line of pull for elbow flexion, and so it can help. It's a little helper. Biceps brachii, brachioradialis, and Pronator teres also pronate or supinate the forearm. So they're involved in a lot of the motions at the elbow, those same muscles. So the biceps brachii, it's our superficial anterior muscle. It has two heads, that's why it's the biceps. It has that corkscrew effect for supination, and I have some cool pictures to show you with regard to that. It has the two heads, the long head and the short head. The origin of the long head is the supraglenoid tubercle. It travels through that bicipital or intertubercular groove and attaches to the supraglenoid tubercle. So when you're palpating your bicipital groove, you're palpating the long head of the biceps tendon. The short head attaches to the coracoid process, and they both join together to a common tendon to insert on the bicipital tuberosity of the radius, also known as the radial tuberosity. So the biceps brachii, they do elbow flexion, forearm supination. They're assisters in shoulder flexion. So they can get into positions of active and passive insufficiency, which hopefully you will explore or have explored in lab. And it's innervated by the musculocutaneous nerve. So this is a cool picture of a biceps brachii tendon rupture. So the long head of the biceps tendon ruptured in this, and you can see how it wasn't suspended up anymore, so it just rolls down the arm and balls up. So that little ball of muscle right there. So sometimes with a torn long head of the biceps tendon, they can repair it, and sometimes they can't. Well, because we have the brachioradialis and the brachialis to bend the elbow and the supinator to supinate the forearm, and the anterior deltoid to do shoulder flexion, we can get along without the long head of the biceps. So sometimes people have irreparable bicep tendon ruptures, especially older people like the gentleman in the picture, and so you can sometimes the orthopedic surgeon will decide that there's not enough usable tissue to repair the rupture. So brachialis is the main flexor of the elbow. Surprise, surprise, not the biceps. It's deep to the biceps. I always think of the brachialis as the keyboard muscle, because when you're in that position where you're working at your keyboard, the brachialis is doing its job. Its origin is on the anterior surface of the distal humerus, and its insertion is on the coronoid process of the ulna. Great line of pull for flexion. So it has that vertical line of pull that's anterior to the medial lateral axis, elbow flexion, and it gets the musculocutaneous nerve. So there's the little exercise we did in lab where we tested strength at different pronation and supination positions. When you're in your pronated elbow flex position, that's where the brachialis is its strongest, because in pronation you're taking the biceps brachii out of it a little bit, putting it on stretch, and that's our keyboard position. So I think of the brachialis as the keyboard muscle. The brachioradialis is longer. Its origin is on the lateral supracondylar ridge of the humerus. It runs along the radial side of the forearm down to the styloid process of the radius. So it does elbow flexion, and it's most effective in the neutral forearm position, meaning thumbs up position. So pronating or supinating the forearm to neutral is something that the brachioradialis can do, because when you're out of that neutral position, the brachioradialis has a line of pull to pull you into that neutral position. So it's the thumbs up muscle. You can think of it like that. The radial nerve innervates the brachioradialis. So unlike the two other elbow flexors, it does not get the musculocutaneous nerve, but you can think of it, brachioradialis gets the radial nerve, it runs down the radius, it inserts on the styloid process of the radius, so all of that is pointing to radial nerve for you. So biceps versus brachialis, our nervous system has a way of selecting just the right muscle for the optimal amount of force for a specific task, which is super cool. that our nervous system can do that. The brachialis is the muscle of choice for most elbow flexion activities. So a lot of times the nervous system will select the muscle that's going to take the least amount of energy first. So the brachialis is relatively small compared to the biceps brachii and the brachioradialis, so that's why it's a good choice. It only does that one thing, elbow flexion. It doesn't have other things that it needs to do. So if you're doing a flexion movement that requires a strong supination component, the nervous system is probably going to recruit the biceps muscle as well. So this guy is screwing in a screw with a screwdriver. We've got that supination component and elbow flexion. The nervous system might decide to recruit the biceps muscle. So all of this happens unconsciously. The nervous system does it for us, which is pretty darn awesome. So sometimes you'll have nervous system injuries that involve a stroke or a brain injury or something like that, where someone's motor planning is affected because the part of their brain that does that is affected. And that's where you get dysfunctional movements, because your nervous system then is not selecting the right muscle for the optimal amount of force for a specific task. So people might have trouble moving the right distance or using the right amount of force or doing fine motor skills. So very interesting. So the major elbow extensor are the triceps brachii. Like the biceps has 2 heads, the triceps has 3 heads. The chief extensor of the elbow is considered the long head of the biceps. It sort of interweaves between the teres major and teres minor to go up and originate on the infraglenoid tubercle. So it's pretty cool how the muscles in the axilla interweave among each other. So interestingly enough, the 3 heads of the triceps, the long head is the only one that crosses the shoulder, so it's the one that could potentially be actively or passively insufficient. And then the other 2 heads, it's not like long head, short head. Long head, lateral head, and medial head. So the lateral head and medial head are distinguished by their point of origination. The lateral head is lateral to the radial groove, and the medial head is medial to the radial groove. And the medial head is the one that's deep to the other 2. So when you see someone with really good triceps definition, you can superficially see the lateral head and the long head, and then the medial head is deep to that. And they all join together into a common tendon, which you can palpate, and they join onto the olecranon process. So all of them together do elbow extension, and then the long head only assists in shoulder extension. So the position of potential active insufficiency for the long head of the triceps brachii would be elbow extension combined with shoulder extension. And then potential passive insufficiency would be shoulder flexion combined with elbow flexion. And it's posterior on the arm, it gets the radial nerve. The anconeus, it's another one of those weird little muscles in our body that, why do we even have this thing? I don't know why those ones get on my nerves, but they sort of do. So it has no major actions. Sometimes it's even considered part of the triceps. So it attaches to the lateral epicondyle of the humerus and inserts on the olecranon process. It has a line of pull for elbow extension with very limited torque, and it's possibly a medial lateral stabilizer, and it gets the radial nerve. But it's another one of those ones that, like, yeah, if you lost your anconeus, it wouldn't matter because you have your triceps. You can do that. You have 3 heads of the triceps. So the elbow extensors can compensate for other motions, there can be compensatory movements if you lose your elbow extensors. So someone with C6 quadriplegia can use the innervated portion of the pec major and anterior deltoid to pull the humerus toward the midline, resulting in elbow extension in closed chain. So with C6 quadriplegia, the radial nerve is affected, and so you don't have elbow extension. So the person can plant their hand and use their anterior muscles to pull the humerus toward the midline, and it makes the elbow extend. So that could be important for stability in sitting, because that person also doesn't have trunk muscles, and so they need some stability in sitting. So this is a hard one to do because it's hard to get your triceps to shut up and not help you, but you can try it. Plant your hand and see if you can contract your anterior deltoid and pec major to pull your elbow straight in closed chain. It's just interesting, but our bodies are masters of compensation. They can figure out how to do things even when we don't have the muscles that normally do them. So one joint versus two joint muscles. I talked a little bit about this. Functions that require large forces for extending the elbow usually demand strong activation of all three heads of the tricep and maybe the anconeus. So many daily functions, just your day-to-day stuff, is relatively low elbow extension force. And the nervous system only has to use the lateral and the medial heads, the one joint extensor muscles. It doesn't have to get the long head of the triceps in there unless you're putting a lot of demand on them. So just like we talked about, where the nervous system is going to choose the muscle that demands the least amount of energy and does the job but doesn't do any more than it has to. So it's a survival instinct. It's a conservation of energy thing. So a lot of times for most of your day-to-day elbow extension activities, the nervous system only needs to use the one joint extensor muscles. And then if you have bigger extension to do, maybe you can throw in those the long head. The supinators primarily are the biceps brachii and the supinator muscle. I love the supinator muscle. It's just such a cool muscle, has a cool line of pull, and also it has a cool nickname we'll talk about. Secondary supinators include the extensor pollicis longus and the extensor indicis because they have that oblique line of pull and attached to the lateral extensor surface, and so they can help with supination. The brachioradialis can supinate or pronate the forearm to the mid or neutral position, that thumbs up position. After that, it doesn't really have a line of pull for supination and pronation. So the supinator muscle, it's called the ice cream muscle because that's what you use for scooping ice cream. So I think that's a pretty cool name for the supinator muscle. It does a force couple with the biceps brachii to rotate the radius. So it actually has a line of pull that spirals around the radius. That's what I think is cool. So it originates on the lateral epicondyle of the humerus and the adjacent ulna, and it inserts on the lateral surface of the proximal radius. So when you're in anatomical position, you're in full supination and the muscle is at its shortest. When you're in pronation, the muscle is actually wrapped around the radius, so then when it contracts and shortens, it pulls you into supination. So I just think that's a cool line of pull. The biceps brachii has a sort of a wraparound line of pull for supination as well, and I have a neat picture to show you with regard to that. It's mostly on the posterior side of the forearm, and so it gets the radial nerve. So the contraction of the biceps brachii from a pronated position can effectively spin the radius in the direction of supination. So the effectiveness of the biceps as a supinator, though, is greatest when the elbow is flexed to near 90 degrees. So the supinator, when you're in pronation, it's wrapped around the muscle ready to pull you around into supination. The biceps, when you're flexed to 90 degrees, and here's this picture that I'm going to show you. So this is a cadaver picture. There's the radial head and the biceps tendon. So at 90-degree elbow position, the biceps tendon approaches the radius at a 90-degree angle. So it's like pulling a string attached to a yo-yo. The linear force immediately produces rotation, and it efficiently rotates the radius, isn't that a neat picture? And you can just see that line of pull, how it wraps around the radius and causes that rotation. So you have supinators, you got to have pronators, right? So our most proximal pronator is the Pronator Teres. It crosses the elbow and the forearm, so it has a slight line of pull for elbow flexion. It originates on there are two different heads of it, the humeral head and the ulnar head. The humeral head originates on the medial apicondyle of the humerus, and that's the one that gives you the assist for elbow flexion. The ulnar head originates on the coronoid process of the ulna, just medial to the tuberosity. And they join together, of course, and they go sort of obliquely across to the lateral surface of the mid-radius. So that's how they can pull you around into pronation. It pulls the radius across the ulna when the muscle shortens. You can see how that line of pull gives you the action. So the pronator, gosh, its name just tells you what it does, right? Forearm pronation. But it also, because it crosses the onto the humerus, it gives you that assist for elbow flexion. It's on the anterior side of the forearm, and it goes sort of towards the radius. It gets the median nerve. The pronator quadratus, it's the little one, the deeper one, and it's a little quadrilateral muscle, a tiny little rhomboid that originates on the anterior surface of the distal ulna, and it inserts on the anterior surface of the distal radius. So when it shortens, it flips the radius over onto the ulna. It does forearm pronation, and the anterior gets the median nerve. So when the nervous system decides, hey, I got to pronate, the pronator teres muscle only assists when larger pronation forces are required, or when you want to get some elbow flexion in there as well. If the pronator teres is activated, the elbow is going to flex also, unless it's neutralized by the triceps muscle. So there's a good use of neutralizer muscles. They keep the elbow in extension to avoid elbow flexion. But the relationship is similar to that of the supinator and the biceps. So the nervous system is going to first try to do it with the smaller, less energy requiring muscle, the pronator quadratus. And if it needs more, or if you need elbow flexion with it, you're going to get the pronator teres involved. So we're going to pick the muscle that requires the least amount of effort first, and then we'll recruit more muscles as needed. So the elbow and the forearm, they're really important to overall function of the upper extremity, because we're using our upper extremities to enact our desires on the world around us, right? We're going to go pick fruit and eat it. We're going to shave, maybe. We're going to do things. So being between the shoulder and the hand, the elbow and forearm muscles have to stabilize that region to allow for transmission of external forces between the shoulder and the hand. So a really important area that you don't think about very often. How often do you think about your forearm? So the structure of the four joints of the elbow and forearm allows for both mobility and stability, and it really helps us transmit those forces from the hand to the shoulder. So kind of a neat yet sometimes forgotten area of the body.